What's going on, everyone? Happy Tuesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, July 23rd, 2024. If you're new to my channel, welcome to my channel. This is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. There's a lot of different viruses out there. We're going to talk about a few of them today, which still remain problematic here in 2024. The COVID pandemic never ended. You may hear less about it in the news, but I can assure you it has not ended and it is still a thing. Want to stay informed with what's going on? Subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell so you're notified when I do my daily updates. And of course, share these videos with anyone you know and leave a comment down below. Doing all those things help my channel grow and help keep more people informed and safe. Alright, today is an extremely busy news day. We have a lot of different things to talk about, including an update on the president and several other things, including some state updates as well. So let's not waste any time and get right into it. First off, starting with an update on President Joe Biden, and Kevin O'Connor, who is the physician to the president, has said that his symptoms have resolved, and over the course of his infection, he never had a fever, his vital signs remain normal, and his lungs also remain clear. And then he adds this: Binax rapid antigen testing is negative. He will continue to be monitored for any reoccurrence of illness. So again, Biden has now tested negative, and in case you're wondering, the president continues to perform all of his presidential duties. Now we'll have to see. He's supposed to give it a speech at some point about him dropping out of the campaign. We'll have to see if he's still coughing. A lot of people who have been close relations to the president, at least so what I'm seeing on the news, a lot of people are saying he did have a really nasty cough during his COVID infection. And we all know, prior to this positive case of COVID, for the last couple of years, when he speaks, he often has a cough, which they blame it on a cold or whatever. So we'll have to see. I doubt that symptom probably really went away, but we'll see here. Good news. He is now negative for COVID. Moving on. Connecticut. This is a soundbite. High levels of COVID-19 detected in Connecticut. Connecticut is not really reporting that much right now, but we do know surrounding areas, such as New York, is also reporting higher levels of COVID at this time. So yes, Connecticut is also seeing a rise. Moving on to this now from the UK. I thought this would be interesting to show. And in the UK, COVID-19 positivity reaches 15.86%. It's the highest figure since October of 2023, and you can see here on the positivity chart, they had a big rise back in April, then they dropped for multiple weeks. May going into June, then they had another big rise in June going into July, then they dropped a little bit, and now once again it's rising again. So this is technically the third time they have rose since April. Very interesting to see that happen in the UK. Seems like anytime a new variant comes along, up goes the UK once again, or subvariant, I should say. Moving on now to this. In New York State, tuberculosis is starting to rise once again. After a 30-year decline, cases of a life-threatening bacterial infection are rebounding in New York State. And it does say here, New York State ranks third for having the highest number of reported cases. In 2022, there were 714 people contracted the illness, which is a 4.4% jump from 2021's numbers. It says additionally, 13 of those infected were multi-drug resistant tuberculosis cases, a jump from 9 such diagnoses the previous year. And then when we come down to this, it says, according to recent data, nearly 900 people became sick with tuberculosis in New York State in 2023. I don't see anything for 2024 yet, but wow. So it's continuing to rise in New York State. All right, moving on now to something out of Michigan. I promised I would share a little bit about of Michigan today, and here we are. This is the best I could find, and of course, Walgreens and maybe some wastewater data. COVID-19 cases now exceed 2023 levels. A summer surge of COVID cases is hitting Michigan, where levels exceed those reported a year ago and is occurring earlier than 2023 surge that started in July. Deaths from COVID remain, however, very low, and it is important to emphasize this surge all across the United States, including Hawaii and Alaska, has started earlier, and in some cases, like the West Coast, is going to peak earlier. We can hope that cases in Michigan end up being lower than last year, but only time will tell. We can see here. Yes, it's higher than last year, but look at this. They would have a long way to go to get all the way up to that level from last year. So again, hopefully Michigan will stay lower than they had reported last year. Moving on to this now. In India, data, COVID shaved 2.6 years from life expectancy, much more in some groups in India. The death rate was 17% higher in 2020 than in 2019, implying on an estimated 1.19 million excess deaths. So in other words, the death rate, the people are dying at a younger age now, thanks to the COVID era. Moving on now to this. In Australia, well, I should say in Paris, where the Olympics are being held, an Australian water polo player is now in isolation after testing positive for COVID. So far, they have not released the name of the player. Then there's an update which was provided here by my moderator, Steve. Thank you for adding this update. I was also alerted to this morning as well. Didn't have a chance to add it. He got to it for me. Fantastic. Thank you so much. They now have a second water polo player that has tested positive for COVID. This is our Olympic tracking thread, and yeah, I got a feeling this is really going to fill up as time goes on over the next week or two during the Olympics. Remember, a lot of them will be staying in an Olympic village, which, I mean, there's thousands of athletes. It's only a matter of time until this becomes a full-blown COVID outbreak. All right, measles in Afghanistan has claimed 21 lives in June. Moving on now to this, something you don't see happen too often, but it is happening in Arizona. Arizona hospital reinstates mask mandate due to COVID-19 cases. Tuba City Regional Healthcare Corporation is reinstating mask mandates at its facilities in northern Arizona, and the article does state that it's because of rising COVID cases at this time. Taking a look at today's national allergy map, and we can see here 27% of the country is in low to medium status, and a lot more of this yellow is starting to show up for pollen levels, which means pollen level, it's in the moderate stage at this time. Taking a look at air qualities. Yes, air qualities are not good. You may have caught, we did a YouTube short this morning while I was out and about today. I was taking a look at the air quality map and saying, whoa, that's really bad. And I know for a fact wildfires are really bad. And let's take a look at this. You can see anywhere in Canada, central Canada, on up through the northern Rockies, through California, Oregon, Washington, Idaho, North Dakota, South Dakota, Denver, Colorado, Montana, Wyoming, Utah, and it even continues over to the Great Lakes now. You're seeing really bad air qualities with, again, the worst being these areas that are in the reds, the purples, dangerous air qualities. And I highly recommend anyone who has immunocompromised lungs or any type of breathing issue such as COPD or asthma, anything in that relation, you probably don't want to go outside. It's going to trigger you to have an asthma attack. I'm telling you, you're going to have breathing problems. And if you do have to go out, obviously you have to go to work and stuff like that, well, try and wear a mask if possible, because this is really dangerous and it might not change anytime soon. And taking a look at this, you can see if the winds are correct, they come out of the correct direction, this will spread to other areas. And take a look here. It is starting to do just that. It's starting to get closer to Chicago. So this is concerning. Obviously, this is something we're going to be following probably for the foreseeable future until a big rain event or something comes into these areas and helps wetten the ground and helps put an end to these wildfires, because the smoke just continues to expand. Hopefully we won't see what happened last year across the United States. As you know, in the East, there was some of the worst smoke and air qualities that we saw in a very long time. Heat-related illnesses, they're not too good either. The West Coast is seeing a high number of heat-related illnesses. The Northeast, the Mid-Atlantic, Southeast is actually not terrible, but they are present. And the Northern Plains is actually not terrible, but again, there are high numbers of heat-related illnesses. Just look at this. Here in Arizona, you're seeing higher than average shade starting to show up as I just go through the county. Same thing in the Northeast. You're seeing much higher than average in Maine, New Hampshire, Vermont, New York State, Delaware, North Carolina. It's out there. It's a problem at this time of year. Want to learn more about the climate and the weather? You can do that over on my Climate and Weather X page, Climate Data Report. Speaking of illnesses and EMS calls and all that business, Philadelphia yesterday, 876 EMS incidents. I don't know why it says incorrect next to that. I'm assuming that's an error, or maybe 876 is an incorrect number. Either way, if it was anywhere near that, that's a lot of EMS calls in one day, considering yesterday was not a 90-degree day. It was just a Monday. Yes, we had temperatures in the low 80s. I mean, no, it wasn't like other weeks where we had high heat, which was causing heat-related illness calls. All right, take a look at this. We got to look at what's going on in Montgomery County, Pennsylvania, where COVID levels are going up. I'll show you that in a moment. And we can see here, respiratory emergency comes up a couple times, cardiac emergency, nauseous, vomiting. And Chester County, Pennsylvania, hopefully we can see this. COVID calls are going up here as well. But at the moment, we're not seeing too many that could potentially be COVID. We do see a couple respiratory emergency calls, but I suspect COVID calls are going up here and in Montgomery County. Why am I saying that? Well, it is Tuesday, and one thing that does happen here on Tuesdays is we get an update on wastewater in Pennsylvania, and we're starting to see more and more orange and red sites show up. Orange represents increase, red represents a large increase, and when we zoom into this map, we do note here that Chester County, Pennsylvania is now reporting a large increase of COVID at this time. And let's see if we can take a look at the chart. Well, no, we don't need to look at the chart, but the point is it is rising. My face is blocking the chart, to be honest with you. And we can see here Abington, Montgomery County, and also in Montgomery County, the Lansdale area is seeing an increase. Harrisburg area is seeing an increase. One of the sites in State College Center County, Pennsylvania is seeing an increase. There's also increases up in Lackawanna County. In McKean County, which is Bradford area, they are seeing a large increase. There's also an increase up in Erie County, and there's also an increase at this time in Mercer County. So, yes, a lot of different areas. And once again, Harrisburg area, that's the capital of Pennsylvania, Dauphin County, is seeing an increase at this time. All right, let's take a look at just a couple Walgreens sites today. South Carolina, don't think we did that yesterday. Actually, before we do South Carolina, I got to give you the national number. The current week's positivity rate is 39.6%. The prior week is 39.2%. Difference of up 0.4%. Total tests 7,637. The prior week was 6,767. And despite the increase in testing, the positivity rate did go up because levels continue to push higher here in the United States. South Carolina 37.8% this week. That is up by 7%, 30.8% last week. Total tests 148 versus 133. Michigan's positivity rate this week 43.4%. Wow, big increase. 26.8% last week. That is up by 16.5%. 143 total tests versus 82. Big increase in testing, big increase in positivity rate. Yeah, you better believe the cases are still rising in that state. New Mexico, 35.6% this week. The prior week is 29.7%. Difference of up 5.8%. Total tests, 45 versus 37. And let's end on a green positive note if we can. Idaho, 22.2% this week, 30.8% last week. That is a difference of down 8.5%. Total test, 9 versus 13. In Canada, the viral activity level for COVID is moderate, flu A is moderate, flu B is not detected, and RSV is low at this time. Taking a look at a wastewater site, I wanted to bring this to your attention. Not terribly concerned just yet, but just something worth watching at this point in time. At one of the wastewater sites in Hawaii, Sand Island, Honolulu, Hawaii, we can see here the COVID levels. They were dropping. Then on or about July 2nd, they leveled off. Now they're starting to rise once again. This is a wastewater site with 390,000 population. Still says high for the levels. And if we take a look at the other wastewater site just to its west, we do note here that the levels have been dropping substantially since about June 3rd. This wastewater site, according to here, I guess they corrected this, peaked relatively early, and now it's dropping, and it continues to drop. But again, there is one wastewater site, and mind you, only 2 are reporting at this time. There were several more before. They're not on this map anymore. Only one of them at this time is rising. Just something to keep an eye on. Thought I would bring it to your attention for today. Taking a look at the latest COVID variants. KP.3 variant is leading the way at 32.9%. KP3.1.1 is at 17.7%, and the KP2.3 variant is at 12.8%, and the LB.1 variant is at 10.5% at this time. Alrighty, moving on. Epidemic status. Yeah, it's growing in the majority of the country, likely growing in the majority of the northeastern states, and stable or uncertain in just a few places. And one of those states is Florida, another is Utah, Idaho, and Oregon at this time. And it's not estimated in some states, such as Missouri, because they simply hardly report anything at all. Taking a look in New Jersey today. Again, remember, New Jersey constantly has big swings each day, and that just does not go for the individual day, but the entire chart here with all the data constantly keeps changing. Well, this is the highest number we've seen them report for the entire wave, with less hospitals reporting. Yeah, not a good thing. 66 out of 70 hospitals reporting, 424 COVID hospitalizations. If we go back to last summer, we do note that during the majority of last summer, they actually remained tame. They didn't start rising until the end of July, which is where we're at now, and that continued all the way. They did not have a peak until around October 4th, which was at 684. I mean, they're already at 424. Hopefully, maybe they will peak relatively soon, but at this rate, should it continue for an extended period of time, they may pass that October level of last year and do so much, much earlier in the year. So we'll have to see what happens. New York State, some bad news, but also maybe a little bit of good news. It would appear their cases have slowed off a little bit. 1,402 cases, but when you take a look at the chart here, overall, they remain on a steady incline upward. But when we take a look at hospitalizations in New York State, yeah, this is not good on the other hand. And we can see here, pretty big increase today. 1,148 people in the hospital, and we compare that to what happened at the end of last week. That was 1,035. So, I mean, that's a pretty significant increase. Not only did that number increase, the number of people in the ICU is now at 110 versus 92. Again, when we go back to last year, let me change this. Let's change this to, hang on, it's going to refresh on me. Let's go back to where they peaked last year, just for comparison. And we can see here, back last year at this time, again, the wave started much earlier. You can see they were nowhere near these levels last year at this time. And the peak for the summer wave last year happened, again, on October 2nd. They had 1,711 people in the hospital, and in the ICU, 170. So we have to watch to see if they pass that level at any point. I don't think they're going to, but I don't know. Take a look here. We're already at 1,148, and last year they also looked like around September 11th. Levels looked like they were starting to drop for a week or so, or it looked like they were intending to, and then it went right back up again because what happened there around September 11th? New York, all the schools went back, and that caused another 3 weeks of rising before they had a fairly decent amount of time that dropped until around about November 20th. So New York State, we are keeping an eye on this, and let's take a look at the hospital admissions while we're at it as well. You can see here, hospital admissions, yeah, they just blow away the other weeks big time. Last week on Tuesday it was 418, today it's 477. And let's take a look at New York City real quickly as well and see what's going on there. And in New York City, when we take a look at the current hospitalizations, we can see they did increase to 550 with 61 people in the ICU at this time. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. We'll have another Pandemic Update again tomorrow. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this with anyone you know, and of course, remember to leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Tuesday evening, and thanks for watching.